Well, as I speak to literally thousands of people every month, both in an audience setting and also by phone calls and emails and faxes and so forth, I get the impression that a lot of people still don't quite get the idea of the difference between digestion and absorption. Two very, very significantly different things. Digestion, of course, depends on two pieces. Digestion requires stomach acid. We'll talk about that in a second. And also it requires enzymes. The stomach enzyme, the main stomach enzyme is pepsin. It is a protein-digesting enzyme. It breaks down proteins into amino acids. It requires an acid environment with acid, the most acid being a pH of 1, neutral being 7. The most alkaline in the pH scale is 14. And so the stomach environment for pepsin to work, to be able to efficiently digest proteins into the individual amino acids, you need a pH level of 1. It cannot be 2. You get it to 2 or above, you're looking at very, very inefficient protein digestion. You start getting a lot of food allergies and other stuff, which we'll get into in a second. Also, the stomach acid environment is required for the absorption of vitamin B12. Okay, you cannot absorb vitamin B12. Even if you're consuming a pound of it a day, you're not going to efficiently absorb it because the intrinsic factor, called Cassell's intrinsic factor, required to assist in the absorption of B12 only works in an acid environment about the pH of 1.2, 1.5 or less. Okay, 1 to 1.5. You get up above 2, the intrinsic factor doesn't work very well or at all. Well, the third reason why you need a stomach environment of acid, a pH below 2, is that the stomach acid environment keeps the stomach actually bug-free. It sterilizes it. Okay, no yeast, no bacteria, no fungus, no viruses. As a result, if you start creeping above 2 and you're moving towards 3 and 4, moving towards that neutral of 7, bugs begin to grow. Yeast and bacteria grow. Suddenly now you're going to get fermentation. Your stomach turns into a big beer-making vat or a big wine-making vat, produces a lot of gas. Oh, then you get heartburn. You get bloating, a lot of belly gas, a lot of bowel gas. Also, you get what's called reflux. You get enough pressure in your stomach, you belch and burp, and that fluid comes up, and it tastes like vinegar, so you think it's acid reflux, but there is no such thing as acid reflux. When you have reflux, it really should be called lack of acid reflux. You acidify your stomach, it sterilizes it, reflux goes away. Just the opposite of what doctors do. Doctors should all be put in jail for sterilizing people's stomach that way and get the pH above, closer to 7 or even alkaline. Ooh, that's bad. Okay, so you want to stay away from the proton pump inhibitors, which stop the production of acid, and you want to stay away from stomach neutralized, things like Tums and Rolaids and stuff like that. Anything neutralized, alkaline water during meals, not good. All right. Then there's absorption. Just as the word implies, you're going to absorb these digested nutrients through the intestinal wall into the bloodstream so you get to the liver and the other tissues. Well, absorption, you can have perfect digestion. You could digest everything down to its smallest parts, and it's all going to come out the other end. The only thing that's going to benefit from all that digestion is the septic tank if you don't have an absorption capacity. Well, what causes a lack of stomach acid first? Salt. Salt is the raw material for the chief cells in your stomach to make stomach acid. You need to salt your food to taste. Do not restrict salt. Do not restrict salt. Salt does not cause high blood pressure. It's required to make stomach acid. Then digestion can be a problematic thing. Of course, I should back up again and say if you have a digestion problem, if you have reflux, it is immediate relief. You can get a hold of our ultimate enzymes from Youngevity, And the ultimate enzymes will acidify your stomach because it does have stomach acid in it to do that. Suddenly now pepsin will work, digesting proteins. The intrinsic factor will work to help you absorb B12. You don't need to go to the doctor's office every month to have B12 shots because you're going to begin to absorb it, and it will sterilize your stomach. That's ultimate enzymes. Then absorption, of course, the biggest absorption problem has to do with gluten intolerance. You start out maybe if you have a gluten intolerance when you're born, well, you might have 5 or 10% of your intestines afflicted, and babies are colicky. Then you get to be 5 to 10. You might have 25 to 50% of your intestines affected. You get to be, say, 10 to 15, 18 years old. You might have 60, 70% of your intestines affected, and you start getting all these afflictions that are due to nutritional deficiency. Well, I'm supplementing with all these things. How could I have scurvy? How could I have pellagra? How could I have beriberi? How could I have protein deficiency? I'm eating all this stuff. I'm getting kidney stones, even though I'm supplementing with pounds of calcium. Well, if you can't absorb it, doesn't matter. I'm chronically anemic. Well, you might be malabsorbing B12. You might be malabsorbing iron. Okay? And so you do need to get on a gluten-free diet. Once you get what we call Hell's Kitchen, the book, and Hell's Kitchen, the CD, goes into this. And, of course, Serial Killers goes into all the hidden places you're going to find gluten. The nice thing about that is if you get on a gluten-free diet, very quickly you're going to see some positive results. If you're a little kid, it might take you a couple of months to repair your intestines. If you're a teenager to a young adult in their 20s, it might take you 4 to 6 months to repair your intestines. If you're 70 years old and you've been abusing yourself with oatmeal for breakfast every morning and pasta and pizza and crackers and cookies and sandwiches made out of whole grain breads and even white bread, guess what? It might take you 6 months to a year to totally 100% repair everything, but you'll see improvement in just a few weeks sometimes, even at that stage, by getting on a gluten-free diet. Also, in addition to the ultimate enzymes, to get the normal flora going, you want to get the Flora FX, root beer belly, and triple treat chocolate. Fun ways to help you with digestion and fun ways to help you with absorption. Contact your Young Give You associate today. Take care of your digestion. Take care of your absorption. You'll add many healthful years to your life. Well, stick with us. We're going to be back with more truth, justice, and the longevity way on Dead Doctors Don't Lie after these messages. Okay, let's see here. Doug, what pearls of wisdom do you have for us today?
I thought we'd talk a bit about statin drugs today, as I have a CNN story headlined, New Guidelines may put 13 million more on statins. Now, the American Heart Association, in concert with the American College of Cardiology, has revised their guidelines on risk factors for heart disease and stroke, and these loosening of thresholds for treating heart disease risk and cholesterol-lowering medication called statins. The recommendations potentially made millions more Americans eligible for these drugs. A group led by Duke University researchers have calculated exactly how many people might find themselves on a prescription under the new guidelines, according to the data based on just under 4,000 people that are in a National Health and Nutrition Examination Survey between 2005 and 2010. 56 million Americans between the ages of 40 and 75 would be eligible for statins compared to 43.2 currently. And under the new recommendations, it would be an increase of about 13 million of these newly eligible. Those, they say, many of these don't even have a history of heart disease, but would be advised to take the drugs to prevent future heart attacks. And the next line is, they say, statins have few side effects. And I'm thinking, well, your body uses cholesterol to make all your sex hormones like testosterone and estrogen, and also there's the risk of Alzheimer's because your brain's made up of cholesterol.
75% of your brain is made out of what we call, the insulation material in the brain, myelin, which is 100%, cholesterol.
Yeah, it's just crazy because, there was that Framingham study that came out, I think it was about 2 years ago, that, found that these statin drugs don't prevent heart attacks. They don't prevent deaths. And now you got these jokers with the American Heart Association and the American College of Cardiology wanting to put a bunch of more people. And I'd be curious to know how many of those people that put forth these new guidelines are somehow tied to companies that make statin drugs. I suspect the pharmaceutical industry is behind this.
Yeah, and probably they own nursing homes, too, for Alzheimer's patients.
Yeah, there you go.
Yeah, the FDA came out in February of 2012 and said, alert, alert, alert. If you use statin drugs, it increases your risk of type 2 diabetes by 52% and your risk of dementias, including Alzheimer's disease, by almost 100%. And they encourage the practitioners to alert their patients, get them off of statin drugs as quickly as possible. Well, guess what? I talk to thousands of people every month. I always ask, how many of you receive this information from your doctor? Everybody looks around, nobody's raising their hand. These doctors should all go to jail for, I guarantee you that Alzheimer's disease is a physician-caused disease because doctors told people, get off of cholesterol-containing foods, eat egg beaters instead of eggs. Well, there's a good one. Egg beaters are made out of oil. Oh, yeah. Take statin drugs. Eat tofu and beans instead of red meat. Eat boneless, skinless chicken breast. Take hormones. There you go. Let's all give each other breast cancer. Okay, what a concept. Well, that's a good one here, Doug, because you're alerting people to the fact that we know that the medical system is just in it for the money because they would not reassess everything to get more and more people on statin drugs if they're listening even to their own cohorts. The FDA says no, 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 and your doctors keep saying yes, yes, yes. I'd ask a veterinarian. Well, stick with us. We'll be back with more Truth, Justice, and the Longevity Way after these messages. Okay, Doug, let's go to callers.
Let's head to Jacksonville, Florida. And Catherine, you're on with Dr. Wallach.
Well, Catherine, you're on the air.
Okay, I've got a question for my husband, about my husband. He's 77. He was on a diabetic pill called, I can't think of it, but it was about 5-6 years ago. It caused him to have almost to the point of have kidney failure, and he's also has cirrhosis of the liver, which has affected his esophagus, the veins around his esophagus. So now the kidneys, they're not totally destroyed. They're coming up over the last 3 or 4 years, but he is taking the Healthy Start Pack plus the daily vitamins. But I was wondering if there's something else he could take to help with the liver and the kidneys.
Okay, how much does he weigh?
He weighs 198.
That's close enough. Okay, so close to 200 pounds. And do you have him on the Healthy Blood Sugar Packs or the Healthy Start Packs?
The Healthy Start Pack.
Okay. All right. Obviously, Shar, are you there?
Yep, I'm here.
Okay, this is a Shar thing. What would you do for almost a 200-pound guy, 190 pounds? He has type 2 diabetes. He's got early stages of kidney failure and liver cirrhosis. What would you do for him?
Well, for the diabetes, he needs to add the sweeties, and for the kidney failure, he needs to add the Ultimate Daily.
Okay. As for the kidney failure, Ultimate Daily. And what about the liver cirrhosis?
Liver cirrhosis, he needs selenium.
Very good. A+, girl. Okay, so exactly as Shar says here, Catherine, your husband needs 2, 1 for each 100 pounds of the Healthy Start Packs. He's going to need 2 bottles of the sweeties per month. That's 3 at breakfast, 3 at dinner. He needs to check his fasting blood sugar every morning before he medicates himself so he doesn't throw himself into insulin shock. And as his blood sugar drops, he will take less and less medication. When he gets his blood sugar below 100, he doesn't need medication anymore. He's an ex-diabetic. The kidney failure is as his creatinine gets lower and lower and gets down below 0.9. Actually, below 2, he needs to be off of dialysis, or if he's getting ready for dialysis, we may be able to prevent him from getting on dialysis with those Ultimate Dailies. And I'd have him take 3 twice a day, 1 bottle a month. Let's start there. Sharp points out the liver cirrhosis, selenium. I'd have him take 9 of those a day, 3 at breakfast, 3 at lunch, 3 at dinner. That's going to help with everything. And also, I would throw in the de-stress capsules, 3 of those twice a day. It's 2 bottles a month. Obviously, keep him away from the stuff that's going to cause him problems. I'd keep him off of sugar. Absolutely no sugar, no fried foods, no processed meats with nitrates, nitrites, no deli slices, sandwich meats, no ham, bacon, bologna, salami, pastrami, pepperoni, or jerky. I'd also keep him away from oils, no olive oil, no coconut oil, absolutely no margarine, mayonnaise, salad dressings, cooking oils, and let's see, no alcohol, even in cold medicine because of the liver stuff. And what would you throw in, Shar, to help get his auric points above 100,000? What would you do for him to help healing stuff?
Triple treat chocolate and or Cell Shield RTQ.
Perfect. Absolutely right. And, of course, if you want to get some stem cells going for the liver, wouldn't hurt to throw in the Immortalium, a couple of those twice a day, 1 bottle a month. Call us every couple of weeks. Let us know his numbers, Catherine. We'll be back after these messages.
Let's head to Idaho. And Glenn, you're on with Dr. Wallach.
Glenn, you're on the air.
Well, hi, Dr. Wallach. Welcome back, and thanks for taking my call.
Yes, sir. How can we help you?
Okay, I'm calling in regards to an acquaintance that I have, female acquaintance. She's in her early 30s, weighs 150 pounds, 5'9". She, at this moment, has human papillomavirus, and she's on Prilosec, actually taking omeprazole, 40 milligrams a day, and has numerous allergies. She's lactose intolerant, and she's at the point now she needs to do something, and I just want to have you tell her what she needs to do.
Sure. Okay. Now, do you know if she, other than this HPV, and usually in women, it has to do with the cervix and stuff like that? Is that correct?
Yes.
Okay. Well, first of all, HPV is the warts virus. Papilloma is warts, just the same sort of stuff. You get plantar warts, you get warts on your hands. It all has to do with the same virus. And I do not believe that it actually results in cervical cancer. People who get HPV usually have the same problems of people who get cervical cancer, but one does not cause the other. They just kind of run together, kind of like diabetes and obesity run together. One doesn't cause the other, but they run together because the causes are related. Okay? Now, so what I would do, at 150 pounds, I'd get her going on, especially since she's lactose intolerant. And lactose intolerance is what's called an inborn error metabolism. Mama was missing something when that enzyme lactase, which breaks down lactose into two separate single sugars. When that thing was forming as an embryo, Mama was missing something, so that piece of her biochemistry didn't get formed. You make up the difference by taking her ultimate enzymes. Take the ultimate enzymes, one or two of those, a minute or so before each meal, a couple ounces of water, and that'll make up the difference of missing that lactase enzyme. Okay, it's what's called an inborn error metabolism. Doctors want you to think it's genetic, but it's not. It's really just Mama missing something when the baby was forming. It's a nutritional deficiency of the embryo. You can actually make up the difference with enzymes, ultimate enzyme. Okay, at 150 pounds, I'd also have her take the 90 essential nutrients, something like the Healthy Start Pack. One of those would do fine. Again, let's see here. Char, what would you do for her immune system? Because she's got this chronic viral infection. What would you do orally for her immune system?
I'd give her a killer biotic. And
Perfect. Very good. Yes, I'd have her take 3 of those twice a day. It'd be 2 bottles a month of the killer biotic, 3 twice a day. That's going to help her immune system, plus 2 of those 8 herbs in the blend will actually have antimicrobial properties. Now, here comes the magic program here for HPV, human papillomavirus, in the female vagina, the cervix, and all that kind of stuff. What I would do is have her employ tampons. And what I would do is get our colloidal silver and put straight colloidal silver right on those tampons while they're still in the applicator. Apply the Envision colloidal silver soaked tampons. Apply them at night into the vaginal tract. Leave them in there all night, and that colloidal silver will kill the HPV virus. It doesn't cause any irritation to the delicate tissues of the lady's sexual tract there. It doesn't cause any irritation. In fact, has a very mild healing property to it, but it also has the ability to kill viruses. And she could do that applicator every night, say, for 2 weeks, and then after that, she won't need it.
Let's head to California. And Jason, you're on with Dr. Wallach.
Oh, Jason, you're on the air.
Hi, Dr. Wallach.
Yes, sir. How can we help you?
Yeah, I've had a small, hard lump about the half size of a golf ball in my left parotid gland area of my neck for about 5 to 10 years, and I never really thought anything of concern. And recently I was getting my wisdom teeth pulled. It's been bothering me for a while, and I had a sharp stinging pain when I was yawning really big, and he told me to go get it checked out, and had an ultrasound done, and they know it's the mass, but they don't know if it's benign or malignant, and so they're recommending, get an MRI and get a fine needle.
Okay, well, let's back up here a little bit. You jumped around here. Now, this mass is in your jaw?
It's right below my ear in that area.
Okay. Oh, it's on the right side or left side?
Left side.
Okay. Is it kind of triangular shape? To make the side of your face puff up? Hello? Jason, you there? Hello? Okay, what happened here, Doug? Doug, are you there?
Yeah, he should be here. Jason, you there?
Can you hear me now, Dr. Walt?
I can hear you now. Yeah, I missed you guys for about 30 seconds there.
Okay, it's about kind of oval shaped.
And it's behind your ear, behind your jaw? Mm-hmm.
Below the ear.
Yeah.
Below it.
Okay, the odds are this is what's called a parotid salivary gland enlargement. Is it kind of squishy or hard?
Hard shell, kind of. Yeah.
Mm-hmm. Yeah, I'd get an ultrasound. I wouldn't do anything more than an ultrasound. What happens sometimes is that you get a plug in the tubing that carries the saliva from these parotid salivary gland ducts that carries the saliva in your mouth. You get almost like a kidney stone in that gland, okay? But it's not a kidney stone. It's a salivary gland stone. Plugs up the works, and so all the saliva, which is continuing to be produced, kind of backs up in there and causes enlargement. That would be my guess because of the location. And did they mention that as a possibility?
Not really. They're just not sure exactly, what it is, and they want to do the fine needle biopsy, and so they can hit some nerves. And it sounds like I don't want to risk doing
Yeah,
extra stuff.
you don't need. Yeah, the odds are you don't need a biopsy. I would just get an ultrasound. No radiation, no invasion, no risk. Yeah, I'd get a high definition ultrasound. That's what I would request, and get back to me. But I would guess it's one of those sort of things, and you can actually, massage between the mass and your jaw with your index finger on that side. Go ahead and massage underneath your jaw. Drink plenty of water, and a lot of times that'll just get that little stone. Sometimes it's just hard mucus to just move on. Also, there's one other thing you can do is take nightly essence. It has all kinds of wonderful enzymes in it. Take 3 of those in the morning, 3 about halfway between lunch and dinner, and 3 at bedtime. That'll be 3 bottles a month. Hopefully within a couple of days or a week, it will have helped you digest that little plug, sometimes just dried mucus or dried saliva, and it doesn't take much to get everything flowing. That knot will just go right down. But get an ultrasound. The odds are it's a benign parotid salivary gland enlargement because the duct or that little tubing is plugged, okay? So get the ultrasound. I'm assuming you're already on the 90 essential nutrients. Is that correct?
On the Tangy Tangerine for about 3 weeks now. Feeling good.
Okay, good. Excellent.
Yeah,
Okay.
And then, if it was malignant, I would probably notice some symptoms then, if it's something tumorous, you think?
Well, it's too early to tell. If it's malignant, obviously you're going to have another problem, but another couple of days isn't going to make that much difference. And so what I would do is just say, hey, make me an appointment for non-invasive, high-resolution ultrasound. I'll submit to that, but no needles, nothing like that, no biopsies. Just give me the high-resolution ultrasound, and then call back to me with the results. Okay. In the meantime, it wouldn't hurt. You can go to another EENT. I'd go to an EENT specialist and say, hey, what is this thing? My doctor scratches his head, doesn't know what it is. Phone books full of hungry ENTs, just walk in the door kind of thing, say, hey, examine this, tell me what you think it is. Get another opinion. Call me back. Okay, Doug, let's go to callers.
Let's head to Wisconsin. And Kent, you're on with Dr. Wallach.
Kent, you're on the air.
Thank you, Dr. Wallach.
Yes,
calling
sir.
about my the preemie baby. My wife and I have been gluten-free for about 1.5 years.
Okay.
And she also has other allergies to lactose and peanuts and doesn't do well with corn or soy.
Okay.
Oliver was born at 29 weeks. That was 5 weeks ago. Today he's 34 weeks, and he weighs 3 pounds, 14 ounces.
Okay, so he's still in the hospital? Or is he home?
He's at the hospital. He's going to be there for a while yet.
Yeah, I understand.
Okay. He's been doing poorly with some of the milk fortifiers that they're trying to add to mom's milk. They started him off on Similac, and within 3 days, he was having blood in his stool. His tummy was
okay, well, I'd stop there. Okay. Now, does your wife have any skin problems, any eczema, dermatitis, or psoriasis?
No.
Okay, does your wife have any history of bronchitis or asthma?
No.
Does your wife have any belly problems herself? She any, like diverticulitis or irritable bowel syndrome, hemorrhoids? Has she ever had her appendix out, anything of that nature?
Occasional problems with hemorrhoids, that's it.
Okay. Do you have any other children? Is this your first?
This is our first.
Okay, well, congratulations. And let's see here. Let me ask you a personal question here. Has your wife, if I may, you don't have to answer if you don't want to, but has your wife had any miscarriages?
Possibly. One,
okay. All right. There's a possibility here. Your wife has a gluten intolerance, and so you got to watch what milk fortifiers and what the baby is actually drinking. Got to be totally gluten-free, especially, does the baby have any skin problems or?
We've noticed dry skin.
Mm-hmm. Yeah, I would be sure to suggest there might be some gluten intolerance here. Get a drop-dead gluten-free baby formula. The baby needs to have the EFA pluses if they're not already giving it to them. Wouldn't hurt to puncture one of those capsules and give that baby 3 pounds. Wouldn't hurt to give him a half of the volume of one of those capsules a day, those omega-3s, essential fatty acids, because I'm concerned about respiratory stuff. And usually when babies are preemies, they will give them omega-3s because the lungs require extra omega-3s. But when you get a bloody stool after adding a particular milk fortifier or change of formula, this tells me there's a high probability there's a gluten intolerance there. So you really got to be, paying attention to that. All right? And
Very
then,
good.
okay, and then, of course, we do have a wonderful non-gluten liquid supplement called Tropical Plus. And it's just vitamins and minerals. It has a little bit of juice in it, so it is flavorful. Kids love it. But there's no gluten in it. And so that would be a great one, a teaspoon for 20 pounds of body weight. So at 3 pounds, what I would do is give like 1/10, half of a quarter, if you will, of teaspoon, or 1/8 of a teaspoon. That'd probably be it, 1/8 of a teaspoon of that Tropical Plus twice a day to that baby in its formula, plus that little bit of the omega-3s to really get that up, and then keep us informed. But I'd be really watching the gluten, make sure Mama's breast milk, if Mama is giving her breast milk, she better stay away from gluten. And that way the gluten won't come through the breast milk. We'll be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity, 90 Life Crusade. And Doug, let's go to callers.
Let's head to Naples, Florida. And Rosalind, you're on with Dr. Wallach.
Well, Rosalind, you're on the air.
Hello, Dr. Wallach.
Hi.
I'm calling about a prospective client that is diagnosed with lupus. She's 25 years of age. She's approximately 135 pounds. And we just want to see what directions we can go with products we can get her started.
First of all, does she have the skin stuff with lupus, like the rosacea on her face, or a little butterfly rash on her face? Yes, yep. Does she have any other skin problems?
No, that's the only skin problem. No eczema or any kind of other dermatitis.
Okay, what about bowel problems? Does she have any constipation, diarrhea?
Constipation or diarrhea? No.
Okay. Does she have any children?
No, she does not.
Okay. All right. I believe, and everything I've done with lupus tells you that it is a cousin disease to fibromyalgia, lupus, sarcoidosis. All these things are psoriasis. They're all related. And she may want to look at her siblings, her brothers and sisters, and the sisters' kids. Let's assume for a minute that she does have a gluten intolerance here, which goes along with lupus usually, especially when they have that butterfly rash. So, Shar, what would you do for this gal? 135 pounds, lupus, got the butterfly rash on her face. What would you do?
First thing is a gluten-free diet, of course. And
very good.
And then I would get her on the Healthy Start Pack 2.0.
Okay, excellent. Okay, one Healthy Start Pack 2.0, perfect. I would also get her the extra glucogel. I'd have her take, since she's got lupus, it'd be a little heavy-handed, but she's got lupus. I'd have her take 15 of those glucogels a day. It'd be 2 large bottles a month. And 15 a day, 5 at breakfast, lunch, and dinner. What else would you throw in, Shar? Because this is a connective tissue thing, a lot of copper deficiencies involved here. What would you throw in?
Selenium.
Yeah, absolutely. The Ultimate Selenium has the extra copper in it, and so I'd have her take 3 of those twice a day. It's 2 bottles a month. It's imperative to stay away from all the inflammatory stuff. Again, the gluten, no wheat, barley, rye, and oats. Have her listen to that CD called Serial Killers and find out all the hidden places she's going to find gluten. Keep her away from fried foods. No oils. Yes, absolutely, positively, no olive oil, no coconut oil, no margarine, mayonnaise, salad dressing, cooking oils. Nothing inflammatory. No deli slices, sandwich meats. No processed meats with nitrates and nitrites. And again, I can't stress enough, no gluten. And Sharp picked the exactly perfect formula for that. Okay, Doug, how much time we have?
We have just about a minute.
Okay, Sharp, we got a minute left. What advice would you like to give people to have them prevent getting some of these illnesses? Let's say that they have high blood pressure and heart disease and lupus and diabetes in their family. What would you tell them to do to reduce the risk of these things?
Well, first of all, I would get your books, Let's Play Doctor and Let's Play Herbal Doctor and Passport to Aromatherapy, and go on, there's all kinds of YouTube videos of you and and Dr. Glidden on there that will tell you what's wrong with you and what you can do to prevent it. And
what
then
would
sign
you do?
up.
What preventive maintenance would you have them do?
The Healthy Start Pack is the basic program.
Well, there you go. Very good. Very good. Do preventive maintenance if you're. And how long have you been doing preventive maintenance with longevity, Shar?
25 years.
Yeah. And of course, I'm telling you, you're a perfect example of how you can really make your life wonderful. You can actually avoid many, many diseases. You've been taking the program for 25 years. How often have you been to the doctor with you being sick?
I haven't been to the doctor ever. I don't get sick.
Well, you don't get sick. Well, there you go. And so Shar is a great example of somebody who's been obsessive about this program, obsessive about these products. She's become a world's expert on this, and as a result, she has a huge group of people that she's involved with, managing and helping them manage their health. Kudos to you, Shar. Thank you so much. Great job as usual. Thank you so much, Doug and Susan. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.